You're watching KETK's East Texas Living with David Gibson.
Welcome back. Joining us in studio today is Dr. Keaton Patel, a pulmonologist at UT Health East Texas. How are you doing today?
I'm good. Thanks for having me here.
Yes, sir. So what is a pulmonologist?
So pulmonologist is the medical doctor that treats respiratory or lung-related conditions. So maybe COPD, which is commonly known as emphysema and bronchitis, asthma, respiratory infection. We deal with pulmonary fibrosis and lung cancer.
Yes, sir. November is Lung Cancer Awareness Month. So how common is lung cancer?
So lung cancer is actually very common. So if you look at the statistics, American Cancer Society put out statistics for 2025. So for this year, they said they would expect 226,000 cases of lung cancer be diagnosed, 110,000 male and 116,000 female, so more on the female than the male side. And they also put out the statistics about the survival rate or the mortality from the lung cancer. So said 124,000 deaths that they expect from lung cancer this 2025. So every U.S. person, 1 out of 18 in their lifetime will be diagnosed with lung cancer. Every 2.2 minutes, there is someone in U.S. will be diagnosed with lung cancer. And it's more common after age 65. So that's the age group that we look for. Think if you diagnose early, you treat them better, and their 5-year survival is much better, which is around 65%. If you diagnose late or advanced case, then the survival goes down, and on an average, about 27% survival at 5 years. So that's what we normally look for. So try to diagnose and treat early.
Yeah. Yes, sir. And so what are some of the common tests or procedures used to detect lung cancer? So
it used to be a chest x-ray, but now we have a low-dose CT scan that what we recommend, and it's approved. So American Thoracic Society and Ad Council has this campaign called SaveByTheScan.org. You may have heard about that, but it's the early detection for the lung cancer. It's the low-dose CT scan recommended for a high-risk individual. So when they said what is high risk, the high-risk individual by definition is that anyone who is between 50 to 80 years old, anyone who has 20-pack year smoking history, which is if they smoke 1 pack per day for 20 years or half pack a day for 40 years, they will consider as a 20-pack year smoking history. And if they're current smoker or quit within 15 years, those patients will be eligible for a low-dose CT scan.
Yes, sir. And I hear there's some new advancements with robotic-assisted procedures and AI tools. So can you tell us about the new advancements available here in East Texas?
Sure. So first thing we look for is, as I mentioned, is the early diagnosis, right? So we want to capture those patients much earlier in their cycle. So low-dose CT chest for those high-risk individuals. And once we have a CAT scan done, then we need to formalize the plan of care. So we have this software called EON. EON. So EON software is what we have. It's an AI integrated algorithm. So it's analyze the CAT scan report, look for the keyword such as lung nodules or finding abnormality on the CAT scan, and then based on that, it generates the patient plan of care, notify the patients and a primary care, and then it generates the follow-up plan of care. So it continues to optimize your identification process. And it's vertically integrated with our Epic EHR system for UT Health East Texas. So we're able to analyze all those CAT scans, able to generate the plan of care, and then have a follow-up with the patient.
Yes, sir. What's the most important message you want our viewers to take away from all of this?
Absolutely. So once we have those diagnosed, then the next step is always talk about the treatment and biopsy and all of that. And we have a robotic navigation bronchoscopy technology called ION bronchoscopy, which is the shape sensing catheter that we use. It's ultra maneuverable, ultra flexible, very precise, get into the smallest of the air segment, and you get down there and you get the biopsy done with the more precision and more accuracy, so improves your overall yield. When you diagnose them early, then you assign them to our medical oncology colleague or thoracic oncology team, and then as a team together, we'll come up with the algorithm and plan of care, how to help them better. To take away point at this point, look out for the symptoms. Not only smokers been diagnosed with lung cancer, we have seen a lot of non-smoker because of their genetic exposure, environmental exposure, occupational exposure. Those are the risk factors. So look out for your symptoms. if you have been a smoker and fall into this high-risk individual, then follow up with your primary care and have a low-dose CT chest done. If there is any incidental finding, then follow up again to make sure that there is someone watching that spot, make sure it's not growing, or if it is growing, then early detection will be what we recommend.
Yes, sir. Well, thank you so much for coming in.
Hey, thank you. Thank you for the time.
Yes, sir. For more information, go to the website right there on your screen.